Hello everyone, today we will delve into the most crucial step in the smile surgery, lenticule separation and extraction. The key to this step is to clearly identify which surface of the lenticule is being separated. Completely separate and extract the lenticule while protecting the corneal cap and ensuring no damage to the incision. This is a common challenge faced by most beginners. This video will provide a detailed explanation on how to safely separate and extract the lenticule, completing the most critical step of the smile surgery. Before the surgery begins, a semi-moistened sponge should be used to wipe the separator and the lenticule forceps to ensure their surfaces are clean and free of various fine particles, such as fibers on the drape, that could be introduced into the cornea. After scanning is completed, the operative eye is moved under the microscope and focused on the limbus, where the conjunctival vessels at the corneal scleral junction are clearly visible. A new semi-moistened sponge is used to dry the tears and secretions at the incision and within the conjunctival sac. Taking a right-handed surgeon as an example, the left hand uses a toothed forceps to clamp the conjunctiva and the subconjunctival fascia at the limbus, and gently lift it up, while the right hand holds the separator. For beginners, it is not advisable to separate the entire upper or lower surfaces of the lenticule at once. Instead, it is recommended to perform a pre-separation of the lenticule, as the lenticule is very thin and almost invisible after the interlayer bubbles disappear, making it challenging for beginners to identify the upper or lower surfaces of the lenticule. The pre-separation procedure is as follows. After the separator tip enters the incision, it is gently lifted up while slowly crossing over the lenticule edge and entering the gap between the upper surface of the lenticule and the corneal cap. The upper surface of the lenticule at the incision site is separated. At this point, the separator can be withdrawn from the incision. Then re-enter in incision. The separator tip is gently pressed down, crossing over the lenticule edge and entering the gap between the lower surface of the lenticule and the stromal bed, and separating the lower surface of the lenticule at the incision site. At this point, the pre-separation of the upper and lower surfaces of the lenticule is completed. The separator re-enters the pre-separated area on the top surface and slowly separates the surface in 2 to 3 strokes from right to left. Care should be taken to continuously keep the separator from pressing down. Otherwise, it will cause the surgical field to lose focus, increase separation resistance, and even damage the lenticule. When separating the distal edge of the lenticule, attention should be paid to ensure that the incision is not torn by the tail of the separator. At the top right corner, 10% of the upper surface should remain unseparated to serve as a fixation point for the lenticule, preventing it from moving freely or sliding when the lower surface is being separated. When separating the lower surface, the separator tip should maintain pressing down. Attention should be paid to whether the lenticule edge is intact and whether there is lenticule rupture when separating the distal end of the lenticule. At the same time, the incision should also be protected from being torn by the tail of the separator. The extraction of the lenticule is the final step in the smile surgery. The lenticule forceps should remain clamped when inserting into the incision, and then slowly unclamped until the head of the forceps fully enters the interlayer. Then clamp the edge of the lenticule and extract it out. It is necessary to check whether the lenticule edge is intact during extraction. Congratulations! Now you have learned the basic operational steps and key points of the smile surgery. The advantage of the smile surgery is that as long as the lenticule can be entirely extracted, other intraoperative complications will always not affect the patient's final vision. It is a very beginner-friendly surgical procedure. If an accident occurs during the surgery and you are unsure how to handle it, stop the surgery immediately, which is always the right choice. The surgery can be performed again after corneal healing. In the following videos, we will analyze in detail the common intraoperative and postoperative complications and how to properly manage them.